Namaste to Savo with you. Today we are discussing about the topic of Barium Meal Follow Through BMFT. BMFT, it is called BMFT because it is performed following barium meal. Means firstly we do the barium meal and then after that investigate further organs investigation. It is a fluoroscopic examination of small bowel including from duodenum jejunal junction यानी कि DJ junction to ileocecal junction IC junction. Means it is the study of DJ junction and IC junction. It is a non-invasive procedure in which contrast media is given to patient orally. Now we are discussing about the indications. First is Crohn's disease. Next, gastrointestinal bleeding means GI bleeding, abdominal pain, small bowel partial obstruction, meta-absorption, abdominal mass, diarrhea, carcinoma of small bowel, and recurrent vomiting. Contraindications: allergy to contrast media, pregnancy, complete bowel obstruction, paralytic injury, suspected perforation. Now we discuss about the contrast media. It is also double contrast study. So it's first single contrast EZ microbar XT means barium sulfate, 100% WYG concentration in 300 ml. Elastographin, iodinated water soluble contrast media. Carbax granules used as a double contrast. When barium sulfate is contraindicated, then iodinated water soluble contrast is used means elastographin is used. Now we discuss about the equipment. Same equipments are first is fluoroscopic unit with spot film device, radiographic cassette, contrast media, surgical gloves, lead apron, gauze piece, and sprit. Patient preparation. Patient is asked for fasting before the night of examination. Laxative tablets are given to patients to empty bowel. Confirm any contraindication to contrast media being used. Metoclopramide 20 mg is given to patient 20 minutes before the examination to avoid vomiting. Now we discuss about the procedure. First is patient is asked to remove clothing and wear a hospital gown. Next, patient is asked to lie down in supine position on floor or table. Buscopan IV injection 20 mg is given to patient orally. No Carbax granules used. When you give the Buscopan, then no Carbax granules is used. For double contrast, instead of giving barium, first Carbax granules are given to patient which produce gas. Means you give firstly Carbax granules, then the barium mixture. After Carbax granules, barium mix is given. It provides the coating of barium on mucosal layer and provide better assessment of mucosal disease. After giving contrast media, patient is asked to lie on his right side, and this allows the making of barium into small bowel. Metoclopramide increase the rate of gastric emptying. Now we discuss about the filming. Posterior anterior prawn films and PA prawn films are taken at the time interval of 20 minutes up to contrast reach ileocecal junction. Compression films are taken to avoid overlapping of the loops of small bowel. Aftercare: patient should be warned that his bowel motions will be white for few days. Advised to take adequate amount of water. Some laxative tablets may help to avoid constipation. Thank you. The session is over. Namaste.